Hi biopsychology peers. Today we're learning about a therapeutic approach that offers a promising avenue for addressing the profound challenges of mental health disorders. It has captivated the attention of researchers, clinicians, and the public alike. With roots reaching back to the mid-20th century, psychedelic-assisted psychotherapy has experienced a resurgence of interest in recent years. By the end of this presentation, you should be able to define psychedelic-assisted psychotherapy and explain the model of a session, understand a bit about the history of psychedelic-assisted psychotherapy, list some of the disorders that it might be used as a treatment for, discuss the benefits and challenges, and neuromechanisms. Psychedelic-assisted psychotherapy, also referred to as PAP or psychedelic therapy, refers to a therapeutic approach that incorporates the use of psychedelic substances, typically psilocybin, LSD, or MDMA. Sessions are set within a structured psychotherapeutic setting to facilitate psychological healing and personal growth. A typical session includes 3 steps. First, a session of therapy prepares the patient for the experience, wherein the importance of adapting an accepting attitude towards the psychedelic experience is explicitly explained. The patient is encouraged to set an intention to trust, let go, and be open. Second, the dosing session is the administration of a psychoactive component, typically given orally. Third, the session ends with a therapy to integrate the psychedelic experience. Within the session, 2 therapists are present and remain with the patient. Sessions last between 12 and 24 hours and are conducted in a comfortable environment. The patient is encouraged to turn their attention inward. They're mostly laying down, wearing eye shades, and listening to a carefully selected playlist of music over headphones as the acute psychedelic experience unfolds. During the 1950s and 60s, researchers began conducting studies on the therapeutic effects of psychedelics, particularly LSD. Results suggested the potential to facilitate profound psychological insights and therapeutic breakthroughs. The term psychedelic was coined in 1957 by Humphrey Osmond to mean mind manifesting. Psychedelic therapy gained popularity in the 1960s, but changing societal attitudes, increased regulatory restrictions, and concerns about misuse led to a decline in research and clinical use by the early 1970s. The late 20th century brought renewed interest fueled by advancements in neuroscience, psychiatry, and psychotherapy. Researchers began conducting clinical trials to investigate the therapeutic potential in treating conditions such as PTSD, depression, and addiction. This re-emerging field has garnered attention due to its significant potential to treat a variety of mental health conditions that we've discussed in this class, including anxiety, PTSD, addiction, MDD, depression, and treatment-resistant depression. In a randomized double-blind study of the effects of psilocybin on depression and anxiety in patients with life-threatening cancer, they found that a single dose of psilocybin produced significant and enduring decreases in depression and anxiety levels, with effects lasting up to 6 months after the session. While the research in this field is still evolving, several studies have reported promising outcomes of benefits in various mental health conditions. These potential benefits include significant reductions in depressive and PTSD symptoms with long-lasting effects after a single session, lasting change from experiential avoidance to acceptance, a lasting increase in the personality trait openness to experience, emotional breakthroughs, catharsis, ego dissolution, and the processing of traumatic memories. These results provide insights into the potential of psychedelics as tools for psychological healing and personal growth. Some of the challenges include ensuring that therapists receive specialized training and credentialing in both psychedelic pharmacology and psychotherapeutic techniques. Other challenges include legal and regulatory hurdles and the societal hurdles of stigma, taboo, and misconceptions about psychedelic effects. Psychedelic substances have been shown to promote spinogenesis, synaptogenesis, and functional plasticity in the amygdala, hippocampus, cerebellum, and prefrontal cortex. They also modulate neurotransmitter systems in the amygdala and insula. A fascinating paper published by Lee et al. Delves into the mechanics of how psychedelics promote structural and functional neuroplasticity. If this topic interests you at all, I really recommend taking a look at it. There are some really fascinating graphics of their results. I've isolated a small amount from one of the figures showing representations of the control neuron and one that has been treated with LSD. You can see a large increase in dendritic growth, both in branches and length, on the neuron that has been treated with LSD, and the second chart showing the large amount of branch growth. This is the entire image of Figure 1 from that Lee et al. Study. I found the graphics so interesting that I just wanted to include the whole image of the figure. The bits surrounded by pink boxes show what I isolated and included in the previous slide. Thanks for joining me, and best of luck in the rest of your studies.